Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Are you one of the millions of women in the U.S. who suffer from severe pain in your pelvis area, abnormal or heavy bleeding, fibroid tumors in your uterus, pelvic prolapse, it's the slipping or falling of your pelvic organs? In the past, these conditions have required pretty extensive surgery, but robotic surgery has really changed the game, making these types of surgeries much less invasive. Here to talk about gynecological robotic surgery are two OB/GYN robotic surgeons. Dr. Bobby Garg is a Scripps clinic doctor who operates at Scripps Mercy Hospital in San Diego, and Dr. Gafori with IGO Medical Group, who performs surgery at Scripps Memorial Hospital in La Jolla. Thanks for being with us.
Thanks for having us.
So let's go through a kind of laundry list this. Let's go through the most common types of gynecological conditions that require surgery. Let's talk about severe pain in the pelvis. What causes it? What are the symptoms? Who gets it?
Pelvic pain is probably one of the more common complaints that we hear about in gynecology. There are many different causes. Endometriosis is probably one of the more common ones. It's the growth of the lining of the uterus outside of the uterus in the abdomen, and also adenomyosis, which is the growth of the lining of the uterus in the actual walls of the uterus. And pelvic inflammatory disease can cause pelvic pain, and also infertility. Ovarian cysts can cause pelvic pain.
What about fibroid tumors?
Fibroid tumors can also cause pelvic pain in some cases, depending on where they are and how large they are.
Overall, these are not cancerous, though, fibroid tumors.
For the most part, no. Occasionally they can be, so an individual doctor can look at some of the signs and see if there's any suspicion of that. And anytime we do surgery, there's an analysis done on all the tissue to make sure. But in general, they're usually benign tumors. But pain and bleeding are some of the major symptoms we see from that.
And what about frequent urination and difficulty emptying the bladder?
Yeah, when fibroids are very large, they can cause those symptoms.
And also fertility issues as well?
Yes, fibroids that grow in the lining of the uterus can cause problems with fertility, and so sometimes they need to be removed before someone tries to get pregnant.
And what is a myomectomy?
That's when you just remove the fibroid tumor itself. So when we treat fibroids, some people require a hysterectomy to remove the entire uterus, but a lot of people, if they want to not have that extensive a surgery or want to be able to get pregnant afterwards, then we really try to do the least amount of surgery possible, which is just to remove that tumor.
So if you have that myomectomy, can you then get pregnant and carry a child to term?
Yes, in most cases.
Okay. Mm-hmm. And the different types of myomectomies, what are those?
There are hysteroscopic myomectomies, which
there's a mouthful.
Yeah, which are actually done through the vagina, and the fibroid is actually removed through the vagina. There are open surgeries, which are the big, extensive surgeries where we make big incisions, and those are typically reserved for patients who have many, many very large fibroids. There are laparoscopic myomectomies, and then robotic-assisted laparoscopic
And once that fibroid tumor is taken out, can it return? Can it come back?
Yeah, up to half the time it can. It
really?
is a very, very common thing. So we really choose that surgery wisely for somebody who has very specific reasons for wanting to do that, especially getting pregnant later.
And that it can come back for somebody who is premenopause. What about postmenopause?
Usually not postmenopausal. That's a little bit more concerning if it grows postmenopausal.
Right.
Oh, really?
Yeah. These
what does
tumors,
that suggest?
Well, the tumors are typically hormone dependent, and so in menopause, your hormone levels go down, so it's a little bit more uncommon to have that. So women that are over age 60 that have new fibroids, that's a bit concerning for possibly a sarcoma, leiomyosarcoma, which is the cancerous growth.
Cancerous. Mm-hmm. So how do you get rid of the fibroid tumor permanently?
Well, permanently, really, the only true permanent cure is a hysterectomy, so removing the entire uterus, so there's nowhere a fibroid could possibly grow back again after that.
And there's no way to get pregnant after that as well.
Right.
So that's what we have to balance out.
So how do you tell the difference between a fibroid tumor and a cancerous tumor?
Well, unfortunately, there isn't a real reliable method to do that other than pathology. When the pathologist actually takes the tissue, the biopsy that we do, and looks at it under the microscope. We do start with ultrasound, and sometimes we'll refer patients for MRI if we have some suspicion of something. But typically, it's really at the time of surgery that the full diagnosis is made.
And then talk about pelvic prolapse. What is that?
So pelvic prolapse is when any part of the pelvic organs, whether it's the bladder, the uterus, vaginal tissue, the muscle and the ligaments that support that tissue just get weaker over time, and they can sometimes start sagging and literally pushing into the vagina and sometimes even protruding outwards. They can cause pain, pressure, urinary problems, all sorts of things like that.
And at what age of life does that happen?
It can theoretically happen anywhere, but it usually is a little bit older, more common postmenopausally, and more common in people who've had multiple childbirths.
So at what ages do women have all of these issues? I mean, are these things later on in life? Does it happen in conjunction with pregnancy, for example?
Well, a lot of these symptoms do occur before people try to get pregnant with pelvic pain, fibroids, but they're usually in the childbearing age, typically. Abnormal bleeding can occur at any point in your life, though.
And in the past, these conditions have required major surgery, like a big cut in the abdomen, right? So talk about minimally invasive robotic surgery, because I know you use the Da Vinci surgical system that was approved by the FDA back in 2005. How does it work?
So laparoscopic surgery was kind of the first major advancement for minimally invasive surgery. So what that involves is, rather than that big open incision across the stomach, 3 or 4 smaller incisions, each less than an inch big. That surgery is an excellent surgery. It's still something we still frequently use, but it does have its limitations in terms of how much range of motion you have, how much instrumentation you have available. The Da Vinci, robotic surgery is a bit of a misnomer that kind of implies that the surgery is being done by some sort of machine. What the actual robot is it's a large machine that holds all of those laparoscopic instruments for us, and we still control all of them, but it allows us a lot more dexterity and a lot more options for the types of surgeries we can do than we could just do with only laparoscopic surgery before.
And so you're saying the laparoscopic surgery, there might be 2 or 3 little tiny holes, but with the Da Vinci robot, you're saying it's a single site
No, it's
surgery?
still the 2 or 3 little holes,
Oh,
but
okay.
but those instruments, there's a lot more options with them, and they have a lot more articulation, a lot more range of movement. And when we look inside the Da Vinci camera, it's actually a 3D high definition visual field compared to kind of the regular 2-dimensional screen. So having that 3D visualization for us makes such a huge difference.
And
for
there's
hand-eye
a good amount of
coordination.
magnification, and honestly, sometimes you get better views of the pelvis than you do on open surgeries, because you can get the camera very close up.
So it's magnifying it.
Yeah.
How many times? Is it like 10 times or something?
Yeah.
What
It can
your
go
eye
up
can
to that
see?
much, yeah.
But and talk about single site surgery.
So single site surgery is a variation of the Da Vinci surgery where it's just one incision inside the belly button, and you can actually put multiple instruments on the camera all through that one incision. It's still relatively early in its formation, so it's very limited at this point. There's a small handful of types of surgeries we can do with that. There is a lot of advancements coming down the line where it really will, I hope someday become more of a standard where we can really just narrow it down to one small, almost invisible incision inside the belly button.
In a couple of minutes, we're going to talk about who is a candidate for minimally invasive robotic surgery and who is not a candidate for it. So just hold this thought. We'll come back to this in a couple of minutes. Let's talk about the benefits of robotic surgery. I know that you talked about the range of motion and the dexterity. So you're saying that the Da Vinci robot can do things and go into different positions that your hands really can't do, right?
Yeah,
Absolutely.
the instruments can. They have almost 360, or they do have 360 degrees of rotation, which can't always do that very well
Can't do that
yourself.
with ours, yeah.
And the computer translates our movements into smaller, more precise movements with the robot. And then the small incisions actually help in terms of recovery for patients. Instead of having a large incision, they have these tiny little incisions. They can even go home that day of the surgery, which is amazing, and then they can return to work much earlier.
All right, so let's elaborate on that a little bit. It is much less invasive, obviously, than cutting open the abdomen. Faster healing, you're saying cuts recovery time by how much? Can you put a percentage on it?
Yeah, I mean, with the open surgery, most patients will stay in the hospital for up to 3 to 4 days for routine recovery. For the Da Vinci surgeries, most of our patients go home the same day.
Right.
And then the return to work can be as long as 4 to 8, even 12 weeks with an open surgery. With a Da Vinci surgery, I've had patients go back as soon as the first week after surgery, and most
absolutely.
patients within about 2 or 3 weeks.
That is wild.
It is, and it's really important
Huge
now that
improvement.
probably around 50% of the workforce is female.
Right.
So it's really important.
Are there risks to this surgery?
The risks are essentially the same as any surgery we do. So every surgery has those inherent risks, of bleeding, infection, all sorts of other complications, and those aren't necessarily different with the Da Vinci robot. In fact, a lot of the studies show a lot lower complications when it's in the hands of highly skilled surgeons compared to the open surgeries.
Some of the surgeries can actually be almost bloodless, which is incredible.
That's
Yeah,
incredible.
Yeah.
And does using this Da Vinci robot, does this actually shorten the time of surgery?
In some cases it can. It really, time-wise, it's probably about the same, especially once you gain a certain level of experience. Obviously, when you're first getting familiar with the technology, it does take a little bit longer at the beginning, but then once you become adept at it, time-wise it's about the same, but that recovery is really where that maximum benefit is.
Yeah, and having a dedicated team at our hospital, at the Scripps hospitals, is really important too. We have scrub nurses and circulating nurses that work with the robot all the time, and so they really know how to set up much faster and get things going for us and assist us.
Now, a lot of women have pain in their pelvis. They have heavy bleeding during their periods. And after you've had a baby, maybe some, bladder issues, maybe leaking, going frequently. So when should you take these things seriously and say, I really need to go see a doctor about this stuff?
Any type of prolonged abnormal bleeding is something that you need to see us for. Excessively painful periods, bleeding in between periods is typically something we would like to see. Any type of postmenopausal bleeding is considered something that needs an evaluation.
Yeah, I would say, especially for pain or bleeding or cramping or anything like that, anything that lasts for more than one period or more than one cycle, it's generally worth at least checking to make sure if there's something else going on. In terms of urinary issues, I would say it's the second you experience anything, it's an issue worth looking into. It's one of the most underreported things that we deal with.
Interesting.
Yeah.
Why is that?
I think a lot of it is just cultural or generational, where people are just taught that this is kind of a normal thing that happens either with aging or after childbirth. For a lot of people, it's embarrassing to bring up unless it's specifically asked, so we try to go out of our way to really get that information from people rather than wait for people to volunteer that. But any urinary issues at all really should be brought up right away.
All right, so we referenced this a couple of minutes ago. Let's come back to this. Who is a candidate for this minimally invasive robotic surgery, and who is not a candidate for it?
Well, most patients probably could be a candidate. I would say any medical problems that would make it difficult for you to be positioned in the way that we need you to be positioned, or patients who can't endure longer surgeries might not want to have this kind of surgery.
Yeah, there are certain conditions where just a more extensive surgery needs to be done. If the uterus is very, very large, if someone's had a lot of previous surgeries before, those kinds of things. But in general, there's not kind of an overall set rule for who can get it, who can't. It really is that individual evaluation.
Right.
And for some people, they don't even need something as advanced as Da Vinci.
Right.
There can be something a lot, less, even, less extensive than Da Vinci, like just basic laparoscopic surgery.
Right. We try to reserve the robotic surgeries for patients that have a little bit more complicated situation. So a normal tubal ligation or a small cyst that needs to be removed, we would just do typically laparoscopically.
Any final thoughts?
I mean, one thing I will say is that we've been using this technology here at Scripps for over 10 years now, and it's across the entire Scripps system, and we have a really, really thorough process here of safety and oversight, and it makes me feel a lot more secure because you do hear a lot of horror stories out there for patients experiencing complications, and we really take that seriously here. We have a lot of oversight, we go through a lot of rigorous training, and I feel very safe operating here, and I know my patients are in good hands operating here.
Yeah, the training is really extensive across the system.
Yeah.
And it's a phenomenal team effort that goes into it.
And we really, we work together, across all campuses. Vale and our different hospitals, and we've been collaborating for years, and we kind of maintain that across the entire system, so we all learn from each other.
Any final thoughts?
I agree with everything he said. It's true. It's a very good place to have a surgery.
There you go, exclamation point. Thank you both very much. We appreciate it.
Thank you.
According to U.S. News & World Report, Scripps is ranked #1 in San Diego and in the top 15 nationally for gynecological care. If you'd like more information on gynecological robotic surgery, just click on the link or go to scripps.org/videos. Want more critical information about your health? We take care of you from head to toe. Please subscribe to our Scripps Health YouTube channel and also follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.